Note-making. In this module, you will learn to make notes and write summaries. Notes are a permanent record of information which help us prepare for presentations, assignments, examinations, seminars, and workshops. Note-making is a complex activity which involves presenting big chunks of information in a concise form. It helps us concentrate on what we are reading, watching, or hearing, to understand new ideas and information more effectively, and also to remember them for a long time. Note-making is acquiring increasing importance due to knowledge explosion. Effective note-making skills enable us to select the information we need from written sources quickly and efficiently. At times, it is difficult to remember large chunks of information. We use note-making to draw the main points of the content. Let's learn to make clear and well-organized notes that are useful for every aspect of study. Let us now look at the essentials of note-making. Indent the notes properly. Use abbreviations to shorten out words to save time. Give a heading or title. Use subheadings, at least 3 to 4. Provide a key to the abbreviations used at the end of the notes. It should be enclosed within a box. Don't include all the information present in an article or paragraph. Avoid using grammatically complete sentences. Write down points without fully expanded verbs, numbering them as you do. Group related points. Change the verbs to nouns and begin points with them. Number the points. Passage. Read the passage carefully and answer the questions below. Almost all of us have suffered from a headache at some time or the other. For some, a headache is a constant companion and life is a painful hell of wasted time. The most important step to cope with headaches is to identify the type of headache one is suffering from. Intention headaches. A feeling of a tight band around the head exists, along with the pain in the neck and shoulders. Such headaches usually follow activities such as long stretches of driving, typing, or sitting on the desks. They are usually short-lived but can also last for days or weeks. A headache is usually caused due to the spinal misalignment of the head or due to poor posture. Sleeping on the stomach with the head turned to one side and bending over positions for a long time make it worse. In migraine headaches, the pain is usually on one side of the head and may be accompanied by nausea, vomiting, irritability, and bright spots or flashes of light. This headache is made worse by activities, especially bending. The throbbing pain in the head worsens by noise and light. Certain triggers for migraines may be chocolate, caffeine, smoking, or MSU in certain food items. The pain may last 8 to 24 hours and there may be a hangover for 2 or 3 days. Migraines are often produced by an aura, changes in sight and sensation. There is usually a family history of migraine. In a headache, pain originates not from the brain but from the irritated nerves of muscles, blood vessels, and bones. These send pain signals to the brain, which judges the degree of distress and relays it at appropriate sites. The pain sometimes may be referred to sites other than the problem areas. This is known as referred pain and occurs due to sensation overload. Thus, though most headaches start at the base of the skull, referred pain is felt typically behind the eyes. Factors causing headaches are not fully understood, but it is known that a shift in the level of body hormones and chemicals, certain foods and drinks, and environmental stress can trigger them. If headaches trouble you often, visit a doctor who will take a full health history relating to diet, life stresses, the type of headache, triggering factors, and relief measures. You may be asked to keep a headache diary, which tells you to list the time headache started and when it ended, emotional, environmental, and food and drinking factors which may contribute to it, the type and severity of pain, and the medications used which provide much relief are also to be listed. This helps the doctor in determining the exact cause and type of headache and the remedy thereof. Next, it is the time to make notes. A. Types of headaches: tension headache, migraine headache. Symptoms of headaches: tension headaches, feeling tight band around head, pain in neck and shoulders. Migraine headaches: pain on one side of the head, vomiting and irritability, bright spots or flashes of light. Causes of headaches: tension headaches, long stretches of driving, long hours of typing or sitting on the desk. Migraine headache: chocolate, coffee, smoking, MSU in certain food items. Treatments for such headaches: self-care techniques for shorter period, doctors advise for permanent treatments. Did you notice how we used abbreviation of some of the words while making notes? As you conclude your note, add a referential column to include the abbreviations. Abbreviations are the shortened form of words or phrases. Abbreviations: ABRVN apostrophe. TENSN stands for tension. TYP apostrophe NG stands for typing. DOC apostrophe S stands for doctors. PERMNT stands for permanent. Now, think of a title that best suits the notes that you made. For example, title: Headaches, Their Types and Treatment. Now, it is time to attempt the second question and write the summary of the passage. Severe headache is a real cause of concern. In order to find an effective cure for headaches, it is significant to understand the type of headache one is suffering from. It can be a tension headache or a migraine headache. Based on the type of headache a person suffers from, he or she is treated. A complete headache diary, if maintained, may help the doctor find the perfect remedy to the triggering factors responsible for it. Self-medication should be done for only a short-term relief and with the greatest caution. Doctors' advice is a must if headaches persist for a longer time. The first step for making notes is to read the passage carefully and identify the important pointers. Highlight the phrases and the words that are crucial in the passage. Now let's practice what we have learned. Read the given passage and make notes based on it. Now it is time to recap. Note-making is a complex activity which involves presenting big chunks of information in a concise form. Effective note-making skills enable us to select the information we need from written sources quickly and efficiently. We use note-making to draw the main points of the content. The essentials of note-making: indent the notes properly. Use abbreviations to shorten out words to save time. Give a heading or title. Use subheadings, at least 3 to 4. Provide a key to the abbreviations used at the end of the notes. It should be enclosed within a box. Don't include all the information present in an article or paragraph. Avoid using grammatically complete sentences. Write down points without fully expanded verbs, numbering them as you do. Group related points. Change the verbs to nouns and begin points with them. Number the points.